Hi everyone, I'm Sarah and welcome back to Music Therapy with Sarah. Today I will answer the question of what happens in the therapy process from beginning till the end. So there are 4 stages: the referral, assessment, treatment, and evaluation. So the referral stage, the patient client themselves can refer to the therapist or people from their circle of friends, family, if they're in the hospital, their healthcare team, doctors, nurses, anybody can refer to a music therapy service. And they can complete a referral form if the institution has one already, or just contact the therapist in phone or email, whatever the therapist has posted on their website, for example. And then we get to the assessment stage. So there's an assessment form that we fill out. This happens maybe a couple sessions into, so that we have built rapport. So this form, it consists of many different domains such as social, communication, psychosocial, motor, musical, just to name a few. So when we're assessing, by the way, assessment is an ongoing process. I'm always assessing every step from the start till the end. So that's why the assessment form, it's filled out at the beginning of the stage, and then we are constantly evaluating as we go. So the big purpose of therapy is to have a goal. So we come up with goals and objectives. The goals are the bigger picture, and objectives are more specific. And it should be something where you can measure, and there's a duration of time that you can evaluate. It should be positive and related to the goal. So for example, a goal can be something like this. Sarah will enhance her attention span by singing for the duration of a whole song or improvising with the music therapist. So there, you have to come up with a SMART goal. That stands for SMART: S, specific; M, measurable; A, achievable; R, realistic; and T, time-bound. So the example that I just provided, Sarah, I'm just using my name, Sarah will enhance her attention span. So attention, that's a social domain. That's the big goal. An objective is Sarah will enhance attention span by, and here comes a specific objective, by singing for the duration of a whole song or improvisation. So that's something you can measure and see the duration and evaluate if Sarah will complete that goal in an X amount of time, which you can work together with the client. All right, so that's assessment. And at the school that I attended, Laurier University, the thing that they highlighted for assessment was something called indexing. So there is a concise indexing and in-depth indexing. So this is where we will record a therapy session. And now this is very important that we get consent from the client and their families, verbal and written consent. All right, so we will record a session and then look at that recording and either do a concise, so you just watch, or I would just watch it from start to finish and just jot down notes that I observe, and in depth, where I would pause the video every time something interesting happens. And there's a big chart that therapists fill out for indexing, called the indexing form, and I'm looking for physical observations, musical observations, writing my own personal responses. What else? Therapeutic interpretation of what's going on in the video. Okay, so that's called indexing. And then we get to the third stage, treatment. So there's a treatment plan, which consists of interventions. And if you watch my other videos, my previous videos, I talk about the types of interventions, receptive or active. So treatment is where the therapy happens, the action happens. So we work together and listen to music, sing, play instruments, write a song together. Those are the big 4. Then the final one, evaluation. And we will write a progress note, which consists of the goals, the progress towards those goals, and recommendation for the future. So a client may terminate therapy because they've reached their goal, or due to funds, it has to stop, or they pass away, or they move away. A number of different factors can play into terminating the therapy. Or so the last stage is evaluating where the client is at, how far they've come, if there needs to be some things that need to be changed and tweaked around. So that's the whole therapy process from beginning till the end. So I hope that was helpful, and I will see you guys in a couple days.